welcome to this edition of Berkshire Matters. I'm Bob Dean. I'm your host for today's show. And today we're going to be talking with our friends from the Brien Center, Dr. Jennifer Michaels, who I think we've done a show with you for 4 or so years. And we have Megan Wroldson, who's first time on the show. And welcome to both of you.
Thank you. Thank you for inviting us.
Megan, I had heard you present at the one of the classes at BCC, and I thought, just the information you were sharing was so important that I wanted to see if you could join us as well. So why don't we start, I guess, at the very beginning in terms of the Brien Center, and we'll start with you, Jenny. What does the Brien Center do?
Well, the Brien Center does a lot, and we've been around 100 years. This is our 100th year anniversary, which is wonderful to be part of the community, helping the community for so long. And we've evolved over time. We help people who have behavioral health issues and people who have substance use disorders. And we treat people who are 1 or 2 or 3 years old and people who are 101 years old. And we work closely with the hospital and other community partners. We run the crisis team. We have residential programs. And we also do more traditional therapy and provide medication. Our goal is really to meet the needs of our community, the behavioral health and addiction needs of our community. And that changes over time, and we've changed over time.
And I think in so many ways, the Brien Center is the go-to agency for mental health and substance use and abuse. Megan, tell us, what is your role within the Brien Center?
So I oversee the adult outpatient clinics in partnership with Dr. Michaels. So we provide services, therapy services and psychiatry services for folks 18 years and up. We have clinics in Pittsfield, North Adams, and Great Barrington. We have a variety of groups, and we have a number of therapists who provide mental health and addiction treatment in general, and then some of them also have specialty services that they offer. We have a day treatment program for addictions. We have a comprehensive medication-assisted treatment program. And now in 2020, we've expanded to provide telehealth, so we're not bound by our physical locations in the same way that we used to be. Although we feel strongly about offering services in the community, so we've kept all of our physical sites open and ready. I also oversee our residential addiction treatment program, which includes 3 recovery homes, 2 in Pittsfield and 1 in North Adams that just opened a few days ago. And then we also have graduate housing where we provide more of an independent apartment-like setting for folks in early recovery. And we also support those individuals with case management.
I don't know even where to begin there. There's so much there. Maybe I'll start with, what are you seeing in regards to this COVID-19 world, this COVID-19 environment, and mental health problems or substance use addiction problems? Are you seeing a lot more because of some of the things that are going on, or are you seeing a lot more?
Megan, do you want to answer, or should I answer?
I'll start. So we're seeing a lot of things that probably would not come across as a surprise to anybody who's living through the pandemic. We're seeing an increased volume of calls and contacts with our crisis division, people who have experienced mental health or addiction challenges in the past, which have been exacerbated during the pandemic, and as well as a number of folks who are experiencing anxiety, depression, and other symptoms who have never reached out to us before. We're seeing the impact on families, children who are adjusting to isolation and changes in their schooling, families that are adjusting to economic issues, threats of loss of housing, loss of jobs. And then in the addiction treatment world, we've seen some very concerning things. We've seen people hesitate to reach out for help, especially help in an inpatient setting. That was especially true in the spring when people didn't want to seek help at their local hospital. And then we saw a number of overdose deaths this year, and that's been a problem in other years in Berkshire County, but it's remained steady and perhaps will increase compared to last year by the time all the numbers are in. So it's very concerning. On the other hand, you know, we see a lot of resilience amongst the clients that we serve and our own staff.
So Jenny, from your perspective, how is the telehealth piece working, and what are you seeing?
Well, I would echo what Megan just said. As far as what I'm seeing, what I'm hearing is I'm really seeing the full gamut of resilience and also problems, and also it's evolving. So just to give you an example, early on, you know, there was a lot of fear, but there were government checks that some people were receiving. So there was almost this odd honeymoon period where some families got to be home together. They had income. And I remember a family telling me that they were able to purchase a barbecue and a picnic table, and they were, you know, kind of in place together. And there was a sweetness to that, you know, the tragedy of COVID. But it's evolved. And so people aren't receiving checks, and they're worried about putting food on the table, and there's an uptick in cases. So it seems like every day is different. And I think our day is different every day. And for the people we serve, every day is different. And that uncertainty can really have a grinding effect on your wellness. So we're seeing that. We're seeing also a lot of very grateful people who welcome a phone call or a Zoom call. You know, we've been around a long time. There are patients I've been treating for over 2 decades, and it makes me feel good to hear their voice and vice versa. So there's some of that, like that warm-hearted gratitude that we're still connected, even though we're apart. You know, we can't see all our patients, but we can call them or Zoom. And, you know, it's also scary because we don't know how this is going to go. You know, we know ultimately we'll be okay, but what will the path be like while we're getting there? And
I think we may have collectively thought we were going to get to a certain point, you know, to the mountaintop, and then start coming down, and it would be all good. And now I think we're realizing that this is going to be a roller coaster, as you know, as the number of cases are rising in Massachusetts and around the country. That, you know, this is by no means going to be over. So I think, you know, as you said, we're going to be seeing a lot of people continuing to feel stress and anxiety and all of those things. Why would someone not call the Brien Center? You had mentioned, Megan, that, you know, sometimes there's a reluctance to call. So why would someone not call, and what can we say to assure that person that it would be a helpful, positive thing if they did call?
I think that for folks we offer a lot of residential services in our agency, and I think there's some understandable reluctance to go into a residential program where you're suddenly living with a lot of people in the middle of a pandemic. So I would really encourage folks to talk to us so that we can explain to them the precautions that we put in place, which includes testing of staff, wearing masks, heightened cleaning protocols, amongst other things. And the other reason that precedes COVID is people don't call because unfortunately there's still quite a bit of stigma attached to seeking mental health and addiction treatment. And perhaps one thing that we'll learn this year is that it affects everybody, and there's nothing wrong with asking for help. But that's something we've noticed in the past. But we encourage people to call. We encourage family members to call. And the very least we can do is give you information about our services, or services maybe that need to be sought elsewhere, but we can at least get people going in the right direction.
So are we seeing, Jenny, an increase actually in substance use? And certainly we're seeing, you know, for people who are injecting, it seems to be a lot more potent, deadly mix of heroin and fentanyl is what I've been hearing.
Yeah, and you know that predates COVID. Most of the, you know, the heroin on the street is actually in part or all fentanyl. You know, it's a scary time because, you know, that's the heroin that's on the street. It's extremely potent. And people are dealing with isolation, and some people have lost jobs, or they lost the structure of their days. And that can make people more vulnerable to relapse. And we know when people relapse, if they're using heroin, their bodies are not used to that high potency. And so that puts them at risk for overdose. Nationally, we are seeing more problems with addiction. Massachusetts, I think overall has not seen quite an uptick in overdoses, but I think our community, our county is having more of an issue of that. And you know, it's frightening because, as I said, we're not through this, we know, and I think the situation might get worse or more dire before it gets better. You know, people are fatigued. This is a long time to be quarantined, to be separated, to not have that routine of your day that kind of grounds you and gives you a place to show up.
Yeah, I think there seems to be a lot of people are just kind of out there disconnected, and if you're in recovery, I could certainly see where, you know, you may be drawn back to some of those temptations, unfortunately. And the current mix of the heroin and the fentanyl, that's a lot cheaper to produce, and it's more plentiful and all of those things as well, right?
Yes, I mean it's a chemistry lab to make fentanyl. You know, if you're making the components of heroin, you have to grow a crop, you have to cultivate it, you have to harvest it, you have to purify it. So if something is very potent, you need less of it to have an effect. So I think, you know, that's a big issue. I have to tell you, the other significant problem we're seeing with addiction is many people have returned to drinking. We're seeing people are socially isolated. I was just talking to someone this morning who said, you know, she had been sober and then COVID hit and she was alone at night and she resumed drinking, and it got so bad that she had to be hospitalized. So we're seeing cases of people with severe alcoholism or almost like a telescoping, you know, a rapid increase in the course of their alcoholism that is leading to problems with their pancreas, with their liver. Some very serious cases because of the stress and the social isolation, and also alcohol is so easily available. So heroin's a huge issue, but alcohol is actually even a bigger issue for more people, at least in our community.
So what should someone who's tuning into this program and maybe, you know, they've received services from you and they were doing well for a while and maybe they're starting to drink again and they're thinking, boy, I need help, but I don't know if I call the Brien Center, you know, they're going to be disappointed. They're going to be upset because they helped me before and I was doing so well and now I'm not. What should the message be for that person?
Well, you know, obviously I would say call in. And the other thing I would say is that we've been in business a long time. We recognize that addictions are chronic illnesses, they're brain diseases. We have a lot of compassion. We're not into the blame game at all. We feel badly when people are struggling with active addiction, and we want to help people. And we're not here to point the finger or blame. We're here to treat people. And I always say, like, you know, help is a phone call away. And, you know, picking up that phone is the hardest part of treatment often. We have great treatment options. We also have 12-step meetings. They're still occurring. Self-help meetings also. People can go online. But these diseases are chronic. They're progressive. They only get worse when you're trying to battle it on your own. But ultimately, they're very treatable. And we can help. The hospital can help. Self-help groups. And I always say people need all the help they can get, and they should get it. So please call us.
So that's the message. Call. And it's kind of like a non-judgment zone because you certainly want to help. And I think too, as you were talking about, you know, as people continue to drink, that, you know, you can have all those other physical complications as well, where I think, you know, sometimes people can drink for a certain while and they think, oh, this isn't affecting me, or it hasn't, but ultimately it'll catch up to them. Megan, what are you seeing in regards to what's the correlation between people who might be using, abusing a substance and mental health? I understand there's a lot of commonality between the two.
Yeah, so historically, mental health treatment has siloed addiction and psychiatric or mental health challenges, and that didn't prove to be an effective way to treat the whole person. So what we rarely see someone with an addiction who doesn't have an underlying mental health symptoms, if not a form of diagnosis. So we focus on treating the whole person. You know, we can prescribe for the whole person. We can offer therapy for the whole person and treat both the symptoms of both the behavior of the addiction and the symptoms of the mental illness at the same time. One thing that we're excited about is that we've opened this new recovery home in North Adams, which is specifically for co-occurring treatment.
Oh, really?
So it's a 16-bed co-ed program, and the people that will be serving there have a diagnosis of addiction, but also experience mental health challenges. And the combination of the two keeps them from functioning optimally in the community. So we hope to treat them for a period of months or weeks at Keenan House North, and then help them create the supports and networks they need to continue their recovery independently in the community.
And that's literally opened within the last month or so, right? So I mean, we're really talking very exciting. Yeah.
It's just within the last few days. Yep, we've been waiting for a long time to get the doors open, and we had a couple of delays. I can't blame it all on COVID, but we're very excited to be open.
Yeah, that's very significant for North County, and that's in North Adams, you said.
Yes. Mm-hmm.
Great. So Jenny, what do you want to add in regards to that combo or commonality of the mental health and the substance uses, and what happens when somebody is perhaps on a medication for a mental health challenge, and then they start to drink again, or they start to inject or use another substance? I mean, I would think that can go haywire with whatever the medication is that they're taking.
Yes, and that's really true. And also for medications for diabetes or hypertension. I mean, as Megan said, we have a very holistic approach, and we want to treat that entire person and work with their primary care doctor. And obviously, one illness, when activated, will affect other illnesses. Here at the Brien Center, we do our best to understand that whole person, and we prescribe medication in a way that is as safe as possible and would not activate another disease. You know, we want to be very mindful of everything the person is going through, and also communicate with other providers. I think sometimes people are under the misconception of, if I have a couple of drinks at night, it'll help me to sleep. It'll calm my nerves, and it's almost like medicinal alcohol. And the reality is, if you have a few drinks, you will kind of pass out or be unconscious or fall asleep, but it's a disrupted sleep. It's not restorative. And what we see over time is this, that it precipitates or causes anxiety, and people will start to get kind of shaky or anxious around 4 or 5, and then they'll have a few drinks and that will go away. They'll misperceive that as, oh, alcohol is helping my anxiety, instead of alcohol is causing my anxiety. The other thing we do is we try to educate people about, habits that aren't serving them. It can be really confusing, and people are trying their best to get through this very hard time. But, for alcohol, again, can be associated with high blood pressure. It can cause liver problems. And so when one illness is activated, we see other problems. And then, there's a cascade or a multiplier effect. People are really suffering.
So maybe it's better for, say, the person that feels they need to have a few drinks in order to sleep, to try to talk with someone at the Brien Center about why is that? Like what is that underlying anxiety or whatever it might be? You know, what can be done about that? Like, and they may not even consider that to be part of a problem that, you know, that maybe they can get some support with.
Yeah, and we can offer that from a number of different angles. A lot of people don't succeed in changing a behavior if they can't replace it with another behavior. So we talk to our clients about healthy coping skills, healthy behavior, exercise, socialization. Addiction is a disease of isolation. And so, you know, encouraging people to make connections in their world. We also, a lot of our therapies focus on mindfulness and present moment awareness, which when we're feeling anxious, when we're feeling depressed, we're drawn away from the present moment and the things that life has to offer us in the present moment. So those are all things that we can address at our agency. And as Jenny said before, we're not coming from a place of blame or shame or judgment.
Because a lot of what I'm learning and hearing is that a lot of what may be impacting somebody and you know, some of how they're feeling in terms of their mental health or, you know, a desire to use a substance can be things from their childhood or some sort of traumatic experience, and they may feel, well, that happened so long ago, that's in the past, but in reality it may not be.
Yeah, we recognize that trauma is part of an addiction and mental health challenges for a number of people, and more people than we think or than we've thought in the past. So there's treatment for that we offer. And again, like Jenny said, it's with a holistic approach. We can help somebody feel safe and grounded in their current life. And then once someone's safe, secure, grounded, that's kind of when you start to approach that sort of deep trauma work.
So Jenny, can you tell us a little bit about what medicated assisted treatment is?
Oh, sure. And you know, it's something that unfortunately is controversial, and it should not be controversial. And okay. So medication assisted treatment, which I actually just call it now like medication, because it's kind of like if you think of diabetes and someone's taking insulin, you would just say they're taking medication. So I just call it medication or medicine now. It seems to always be changing. It's really kind of cool. We're reevaluating how we speak about treatment for substance use disorders. And so medication for opioid use disorder or medication for alcohol use disorder. So these are medications that address symptoms of craving and withdrawal. Medication-assisted treatment or just medication for opioid use disorder are road-tested, or we call them evidence-based. Evidence-based means that there have been multiple trials throughout the country, throughout the world, to see how people who struggle with opioid addiction do when they are getting this medication. And study after study has shown that when people receive this kind of medication, and these are medications like methadone or buprenorphine or Suboxone, that these medicines address symptoms of craving and withdrawal from opioid use disorders. And when people are on the right dose, the most common thing people tell me is, I feel normal. You know, I don't need to use a substance. I don't feel like I'm craving, and I can go about my life and be a good family member, a good member of the community. I can work again. There's also a medication called naltrexone. Injectable formulation is Vivitrol, and for some people that's effective. It's actually been used more for alcohol problems, less so for opioid use disorders. But when we're talking about medication for opioid use disorders, we really think about methadone and buprenorphine. It gets tricky and people are confused because these are both opioids. They're in the same family. So that's why it's controversial for people who haven't really studied this area. We're giving people who have an opioid use disorder an opioid. And so some people might say, like, why are we doing that? You know, why would we ever give them this medicine? Well, they're very long acting. They're very safe. When given the right way, people don't get high. They're not intoxicated. It addresses an opioid deficit that we see when people have chronic opioid use disorder. And it saves lives. People who are on these medications are significantly less likely to be using opioids and significantly less likely to overdose and die. And there actually was a study in our state that looked at people who overdosed and went to the emergency room and got started on these medicines and followed how they did a year later. And people who were on the medication-assisted treatment or medication were significantly more likely to be alive a year later compared to people who didn't get on that medication. So it's kind of a no-brainer, and I just wish people would stop obsessing about this medicine. You know, like it would be like saying, if somebody has diabetes and they're taking insulin, saying, you know, you're cheating if you take insulin. You know, of course they're not cheating. They have a disease, and this is an evidence-based treatment.
We have about 2 minutes left, and one thing I just want to mention that I should have asked at the very beginning is, in terms of addiction, it's a disease as opposed to being a question of willpower. Is that a fair statement to make? Yeah. So when we're talking about all these things, and we're talking about a medication that can help, it's really to take away, as you said, the cravings and make somebody just feel normal again. And the goal is ultimately to wean them down to perhaps get off it, but some people will stay on it for indefinitely, kind of thing.
So the goal is to lead a happy, healthy life, really. I treat people, Megan treats people, our goal is for the people we serve to be happy, not struggle, to reach their goals in their life. And for the vast majority of people on these medications, that means that they're going to stay on the medicine. Just like for the vast majority of people who end up taking insulin, you know, we don't say, you know, when are you getting off that insulin? We say, you know, how are you doing? How's your life? Are you functional? Are you happy? Those are the same questions we ask our patients. I really like that, because it just like, we need to rethink these things. We need to, how we think of these things, and just, again, look at it like addiction is a disease. And if there's a medication that can help somebody, as you said, to live a happy, fulfilling life, then that medication can be prescribed, and they will continue to receive that medication. We've got about 10 seconds left. Final thoughts. Who wants to go? Jenny? Megan.
Megan?
The best part of our work is watching people get better. So please reach out if we can help.
Awesome. Well, thank you, Megan. Thank you, Jenny. It's always good to hear from the Brien Center. Keep up the good work. And for those who are joining us, we know this information can help you or someone you know. So give the Brien Center a call. Be well and be safe. Thank you.
Thank you.
Thank you.